All right. Thank you, everyone, for joining us for today's webinar. We are using StreamYard today instead of Zoom. So this is new for me. So thanks for being here for my inaugural StreamYard hosting. But we do have Michael, our producer, in the background to make sure I don't screw anything up. Um, while we're waiting for a few more people to come in, I just wanted to kind of go through our normal housekeeping items, but they're going to be a little bit different. So with StreamYard, you'll be able to post a comment during the presentation, so you can ask questions, and let's try to make this as much of a dialogue as possible. And then the other thing is just going to be our normal disclosure. So let me move over to that now. So this presentation is made for educational purposes only. Camaplan is not an advisor. We encourage you to go and seek out your own advice, do your own due diligence, and use other professional resources like tax attorneys, advisors, CPAs, etc., before making any kind of investment decisions. If you have any questions that don't get answered today, or you just have a self-directed IRA question, please don't hesitate to reach out to us at the email address and phone number there before you. So without further ado, I'm going to go ahead and remove my screen and throw yours up, Anthony. All right, and the floor is yours, guys.
All right, welcome everyone, and thank you for watching, and thanks, Matt. My name is Ronak Vyas. I'm the CEO and co-founder of MedCoShare, and I'm here with my other co-founder, Anthony Khan.
Hello, everyone. All right.
All right, we're pretty excited to go through this presentation with all of you. All right, can we get the next slide, please? So what MedCoShare is, it's a medical co-working space and services company. What that means, it's a shared flexible model for independent private practitioners to be able to get started quickly and affordably. My background is in commercial real estate, and that's where I first saw the major sort of discrepancy between what landlords wanted and what smaller independent practitioners needed. For practitioners, they need less space with less of a commitment. And then for landlords, typically they want tenants to do 5-10-year leases. There might be a large security deposit or fit out costs. So essentially, there's a major gap between what the two parties basically needed and wanted. MedCoShare covers that gap by us leasing the space from landlords on usually a 10-year lease, and then turnkeying the space and providing it ready to go for the practitioners, and they can join on a monthly basis, giving them the most amount of flexibility in all of medical real estate. All right, next slide. So just continuing on that, it's not just about the flexibility, it's about the affordability as well. When practitioners typically lease, they're leasing more space than they usually need. With our model, you're able to rent part-time or full-time rooms. So these are turnkey rooms that are basically ready to go, and you only need to come and start seeing your patients. You don't need to fit it out. Of course, there's an option to do that. If you have a full-time membership, you can get one or multiple rooms to fit out based on your needs, but it's not necessarily something that you have to do. With that, we also added other services to support these practitioners, because it's not just the real estate problem that we solve. We also solve the marketing piece, which we'll get into a little bit later on into the presentation. So this is a huge opportunity. While many people believe that independent practices are dying, that's not necessarily the case. In many markets, it's actually a growing trend because it provides autonomy and the freedom for the practitioner to treat patients how they want to be treated. Medical real estate it's a massive market. we estimate it to be, close to a $500 billion market. There's quite a few physicians that we can reach, as well as other people in wellness. So you can think about estheticians, chiropractors, anybody in wellness. So we're going after a huge market that really hasn't been tapped into before.
All right. And Veronica, I could touch base on this part right here. And hi, everyone. I'm Anthony Kahn, the CEO at MedCo. And as Veronica was alluding to, there's so many different practices that are going private, and also direct care models that are accelerating as well. So the number of practitioners for our locations keep growing and growing. So private practice, just from that point of view, what we're offering right now, the clinical exam rooms is the first phase to allow folks to get their practice started, and we offer flexible memberships so that they can do that at a part-time or full-time basis as they're growing into their new practice. And it's flexible, that allows them to be month to month, and we're providing the rooms with the patient tables and some basic equipment that allows them to basically see their patients in a flexible arrangement. And some of them can be doing that while still working at the big hospital systems as they're transitioning. We take care of a lot of the basics as well, including the waste, blood and sharps containers, and removing that as needed. We have folks that can do small surgical procedures at our locations. We don't offer as a major surgical center or anything like that, though. So the clinical exam rooms is kind of the first step to get them in the door, and then as they're growing their practice, they need support services, and that's anything from having medical assistants, admins, getting help with marketing their practice, and other areas. Revenue cycle management, when we talk about billing and practice management, those are areas we're growing in as well. And there's also a lot of other additional streams of revenue that I'll allude to later that we're working on. From the practice management benefits, we offer for them to flexibly schedule their visits, whether it's a half session for the day. They don't have to book out the whole day, so it's pretty flexible. We do it in 4-hour blocks. That allows them to see multiple patients in that time, and it's a better use of their time. They're gonna try to schedule multiple patients in one visit to maximize their time also. We have rooms that are geared to patient, like exam rooms, and then we also have more like counseling rooms for talking with your patients, whether it's through psychology kind of visits, or even telehealth sections, areas that they could do in the office itself. So we have different setups for rooms as needed, and office space for admins to work in as well, and charting stations as well. So we offer a good amount of options that allows a practice to grow and expand as their personnel grow too. The practitioners can, as they're grown, also get additional rooms. So I mentioned part-time to full-time, and then there can also be multiple rooms that they end up getting as they grow. We have multiple locations. We try to grow in a spiderweb type of network that allows them to practice at multiple locations at the same time. And we've seen that as a benefit, especially when opening up another location and we have a wait list of, say, 6 or 7 people ready to get started in that location to expand their patient basis. All right. To give you an idea of the growth trends that we've had over the past 3 years, in 2023, our annual revenue was at $533,000, an increase in 2024 to $759,000. That's a 42% increase. And just this past year, we were just under $1 million in revenue, and that was at $950,000. So it's a 25% growth. And we're growing each year. As we're growing, we're reinvesting to grow the business, add additional services, help the doctors serve their patients better, and add locations. Our membership numbers, as you can see, has been growing from 2023 to 2025, from 45 to 75 to 116 members as we ended last year. So that's a continual growth where our memberships are growing at a large rate, and we will continue that trend. All right. Regarding services, Ronak, would you like to run through the services?
Yeah, absolutely. So services include things like marketing support, staffing as well. So we provide MAs to our practitioners as needed. It's an additional cost, but for us, it's a great way to support all the different members that we have. We launched this in 2024, and we're able to bring on 31 clients since then. 10 are external, so this means they're coming outside of the MedCoShare ecosystem. So that's been a great testament to what we've been doing, providing services like SEO, website development, content creation, social media management to these independent practitioners who typically are competing with much larger clinics and hospitals. All right, next slide, please. So currently we have 4 locations. We have 2 that are currently in contract negotiation. The first one we opened in Philadelphia. We opened one in Marlton a couple of years after that, and then King of Prussia. And then we also did a landlord partnership in Pearland, Texas. The partners we have there are gung-ho and us, opening more locations with them. And we plan to roll out that model in other states. While the Northeast is our backyard, we're getting interest from landlords and other folks in business, like from all over the country. That's kind of the reason why the Boston, Massachusetts location popped up, is we have a landlord who's willing to partner with us to open a site out there. So our team, there's 4 co-founders. We have a great team of people that handle not only the services side, but also the offices. So each office will have an office manager. We've been fortunate enough to have really good folks with us, and with a group of about 10 people, we're able to scale up and to be able to accomplish what we've been able to accomplish so far.
All right. I can touch base on the competition here.
Sure.
And we have there's no major national player. That's a key thing to understand, because this was a new market when we got started in 2020. We were just one of a handful of companies that were actually doing this across the country. Now we're in New Jersey, Pennsylvania, and Texas, and continuing to grow, like Ronak alluded to there, where we're working on a location in Boston that'll expand our state locations as well. We're looking to be the biggest in the country, and we plan to be the national leader as well. Some of the differences here, we understand real estate. That's where several of our backgrounds are from, and then one of our co-founders is also a physician. So putting those minds together was what allowed us to kind of grow this out and look at it as more of an expanding business, rather than just a single 1 or 2 locations. So there's several different companies in the industry now that's grown over time. There's over 20, but here are some of the other ones that you can see that are in other states that we're in, but we're the only one in 3 states at the moment, and continually growing. MedCoShare, Philadelphia is our home base where we started, and our advantage is our reach. We're able to get to multiple locations. We're working out additional models, like Ronak alluded to, with the partnering, and that allows us to expand faster as well. There's additional things we're working on in order to expand our reach quicker to additional locations, working with landlords and other business owners. So we're going to continue to grow this as our revenue increases to expand our footprint. And what does that look like from an investor point of view? Ronak will get to later in the presentation. Just to give you an idea of some of the projections we're working on. So as our services are increasing, we plan to grow that income stream as well. Our rental revenue is kind of contained based on the square footage that we have to rent out, but that revenue is going to go up for every location based on our services that we're able to offer to support these physicians also. So that's another way we're going to continue to increase our revenue streams. And I'll jump into a few additional ones after. Our total revenue for 2025 was just around $1 million, with our services and our rental revenue. And then in 2026, we plan to be closer to 2 million, and then closer to 3 million in 2027. So additional revenue streams that we are looking at for growing the company revenue streams is through technology. There's a lot of telehealth options that we can do. As we go into new markets, it allows any telehealth company to join us also, because they need to have office addresses in every state in order to practice or see patients in those states. Membership tiers, we plan to add on premiums where we can maybe do priority bookings or multiple location access. Like I mentioned earlier, there's physicians that are practicing with us in 3 different locations even. And we are working on different ways to allow that access to happen more seamlessly and at a premium level. There's also partnership and affiliate networking that we can do with local pharmacies, with labs, with other medical providers, or even pharma companies. Sponsorship and advertising, that's another area we can add that into the offices. We currently host events, but then also displaying advertising and developing another stream through that on the TV displays in our waiting areas. So there's a lot of AI also driven areas that we can expand on. And Ronak, if you want to just jump into those, and then we can go over to the next slide after that.
Sure. So we're working on launching our practice management services, and to make these practices a little bit more efficient, we're looking at different AI vendors that are out there to help support these practices, and that can come in the form of like medical transcription, AI patient triage tools, or things that can help with billing and coding. So basically, we want to get one step ahead of what's currently how most practices are currently being managed right now. So our goal is to basically provide a vertically integrated ecosystem for private practitioners with the help of AI as well. So we're pretty excited about this year. We want to open 4 more locations, which would double our size. As I mentioned earlier, we have 2 that's currently being negotiated. The other 2 are, we're scouting locations for that. In addition to the locations, we want to grow the services. And we recently hired someone to help us launch our practice management services. We feel like that's going to be a great additional sort of help for the practices, but also from a business perspective, it's a higher margin business, and we feel like that add-on will really help our bottom line as well. We're also looking into franchising or partnering with landlords across the country. This mitigates our risk with the cost of capital of going in, and it helps grow the brand, as well as being able to open a bit faster. So this is a great way for us to grow in 2026 and beyond. And the next stage is we want to do a Series A fundraising round, which would catapult us into kind of the next level. Right now, we are, I would say, the second biggest medical co-working company. The goal of this year is to be the biggest, and then really after that, just take off from there. So why invest? We clearly meet a market need. We've had 130 different practices with about 115 that are current. So we have a long retention with these practitioners. The demand that we see in the Philadelphia region, we think that the demand will continue to hold in other parts of the country as well, because there is a clear trend for salaried physicians to want to do something else, to kind of break away from the hospital settings and then regain that autonomy, and freedom and satisfaction that they lost. It's the second reason to invest is an early adoption phase. So I like to compare where medical co-working is to urgent care centers. When urgent care centers were launched in the 1970s, there were very few of them, but then it kind of just exploded to where they are on almost every block nowadays. And I feel like medical co-working is going to reach that level of that status, because there's just quite a large demand and for practitioners who want to go independent. We're 5 years in, so at this point, we feel like we've proven the business model. It's not about testing an idea. This is about raising funds to grow the market, to grow the company, and it's a great team that we have. We're passionate, but we're also in a bunch of different cross disciplines. So while I come from a real estate background, Anthony has a healthcare management background in addition to real estate. Another co-founder is an engineer and an investor. Another one is a doctor. We have great advisors that are physicians. So we have a great mix of disciplines to help us guide us in the next phase of growth. So our goal is to raise a $1 million seed round. The minimum investment is $25,000, and the use of funds is to open more locations in Pennsylvania, New Jersey, Florida, Texas, other parts of the Northeast as well. About $250 will go to staffing and marketing for these new locations, and another $250 would be to grow the services division, which we feel is an integral part of the business. And it really allows us to help solve any of the problems that independent practices face.
Great.
Our exit strategy is we want to exit in the next 3 to 5 years. Our current valuation is $10 million, but we want to 10x that to get to an exit that would be beneficial for all the investors involved. And we feel like we have a great blueprint to get there. Obviously, it's going to take a lot of work, but I think we're all prepared for that. And basically, 100% of the funds that we're raising is going to the growth of the company. Right now, we are cash flowing, and so we're sustainable. So we feel like any additional revenue that we can get, whether it's memberships for our locations or clients on the services side, that can help with our top line growth to get us to that $100 million valuation that we want. And we're 5 years in. We think it's going to take another 5 years. And then after that, we see a good exit for everyone involved.
Yeah. All the additional revenue streams that we talked about are coming directly from our members. We survey them on an annual basis, and we understand their pain points from that, and then know what needs they have that we can actually fill. So that's a huge part that makes us really excited about the future, knowing there's a lot of areas we can help them, and then also grow the revenue streams for the business as well. All right.
Thank you for your time, and we're open to answering any questions that you guys have.
Yeah, absolutely. So thanks a lot for that. I don't see any questions yet, but I have a few questions. So if you'll have to humor me for a bit, because I think this is a really incredible idea. First, if you could just, so as I understand it, this is co-working in a medical context. So that means that on certain hours of the day or certain days of the week, a room in one of your sites would be used by a certain medical professional, and then other days of the week it would be used by a different medical professional. So if that's a correct understanding or close to it, what's sort of like, walk me through an example of what's been sort of the happiest marriage of having people be in these of having specialists be in these facilities.
Yeah, man, that's a good example. Well, the example I would like to give is of a patient. So a patient came in with foot pain, and we have a podiatrist in our King of Prussia office. And as she was walking down the hallway, she noticed there were other practitioners in the space. So there was a chiropractor.
Nope.
He
Looks like
froze. Oh,
the chiropractor. Then there's also primary docs that we have there too.
okay.
And yeah, Ronika froze for a moment. So
Oh, no worries. Yeah. So basically, she realized there are other, doctors and specialists in the space. So she ended up making several appointments, even though she just came to see the podiatrist. So we look at this as a B2B2C company, right? We're working directly with, the doctors, but ultimately they need to make their patients happy, right?
Right.
There need to be greater clinical outcomes and greater satisfaction for the patients. And we see that we see so many patients come in and realize that we're almost like every location is almost like a little medical campus.
Right.
And it also helps from the doctor's point of view, because now they can refer patients, to another member that's down the hall versus, across the town.
Right. Yeah, and I mean, especially if you're dealing with like an elderly population, for example, they can't afford to be going from place to place to place. So having that kind of like campus structure helps them to be able to go to all their appointments.
Matt, one of the biggest things I've seen with the patients also is their ability to get appointments quickly and being able to see the doctors within a few days. Even sometimes, like Ronik mentioned that scenario, one of the doctors was able to make some time to see that same patient that came to see the foot doctor for that same day while they were there. So it's amazing that they can do that. They have that flexibility, and the doctors also have quality time with their patients. They're going to see their patients for maybe half an hour or more, not a 12-minute timer going off where then they have to go see the next patient, like in your big hospital systems, and you're just a number and they're reading off a chart. Did you do this? And you feel like you don't have that connection to your doctor and they're not paying attention to you.
Right.
So we see that where there's a lot of satisfaction for the patients as well.
So kind of going back to just, this is just me understanding exactly how these sites are set up. If I go to my my dentist, for example, my dentist has a mouth surgeon at a place down the hall, or not down the hall, but like within the same building, and then there's probably an orthodontist on the first floor or something. So how is what you're doing kind of different than that what I see at my dentist today?
Well, it's quite similar, right? So the goal is to bring in specialists and other people in health and wellness that are complementary to one another. So, for example, if you're a diabetic patient, the three docs that you need to see is a cardiologist, primary care, and an endocrinologist. So if we're able to have all three in one location, for example, then that patient can make appointments that's convenient for them, where they can see one or multiple specialists that day. And as Anthony was mentioning, being able to have an independent practice allows you to control your own hours. So right now, like in the Philadelphia region, you see the wait times for hospitals to be 3 months, 4 months, 6 months to see a doctor there. Where what we're seeing is a lot of patients are getting same day or next day appointments. So being able to see your doctor faster, and then having more than one type of doc in the space really is the best case scenario for these patients.
And I think from, listening to what you said about being like an accelerator for private practice, I'm guessing like kind of the pitch that you're making to healthcare providers who are in like a managed care system or a hospital system is they might be thinking about going to private practice, but obviously that's comes with a lot of that can be overwhelming. But you're saying, hey, we can identify the site, but not only will we identify the location for you, you'll be with complementary healthcare providers who will support your business and you'll support theirs. And you also have the additional business services that you offer to kind of steward their business, steward their private practice.
Yeah,
Absolutely.
that one of the biggest pain points we found for the doctors is the administration and managing the practice. And when we can take some of those things off their hands, they absolutely can thrive in what they do best, which is focus on their patients. And that's what they want to do.
And so that's actually a good segue to my other question is, my dad is a physical therapist. He's had his practice open for 40 years. And if you asked him, like, what's the biggest pain in your side, it's dealing with the insurance paperwork. And I was just talking to my optometrist, and she said she's it's private practice. She said the exact same thing. She's like, I don't know if I want to pass this down to my son because private practice is hard these days. So my question that I had while I was listening to you is, how do you sort of navigate that rather large pain point for people who are thinking about going into private practice and make it something that is something that they can deal with through your services?
Yeah, so the problem that they're alluding to is basically working with payers, which are the insurance companies, is difficult, and they're getting reimbursed less and less. So it makes it more difficult to have a practice, right? Especially if you're running a practice part-time. One of the things that we're doing is, because the cost of entry to start with us is so low, they have a bigger sort of gap, right? Where they can say, all right, well, why don't I try concierge care and not work with the payers? And I'll charge them less because the rent I'm paying is a lot less than it would have been if I was to buy the real estate or do a lease with a typical landlord. So when the cost goes down, the savings can be passed on to the patients, which is what we're seeing chiropractors that do concierge care, obviously primary care docs. And you mentioned your dad is a physical therapist. I actually just met with a physical therapist last week, and he's thinking to do a concierge PT practice for runners. So, our model really opens up a lot of creative ways for practices to thrive, right? Which this never existed before. So that's why we're so, optimistic about the idea.
That's a great. That's really interesting because my question was about dealing with insurance sort of in a typical practice setting, but you're saying that your the way you have it structured allows for more specialized or unique or just different concierge services. So kind of a different way to think of the health provision. We did have a question come in, and the question is, are there any restrictions about what the practices the doctors can have? For example, non-traditional doctors, functional medicine doctors, can both Eastern and Western medicine doctors practice?
Yeah, that's a great question. And like Ronak had talked through some of the practices we expect to see, but then there's so many more that come through. And we do have a mix where it's you do have non-traditional in there as well. You do have Western medicine, holistic doctors. We have those as well as your direct primary care. We have ones that accept insurance, others that don't accept insurance. So it's a variety, like the concierge practices. We have a few of those working in our spaces as well. So it's a wide variety of practitioners. You have aestheticals, you have cardio, you have minor surgical procedures that happen, you have ENTs. So it's way more than we initially thought that would be able to thrive in this environment. Like Ronak was mentioning to your question, Matt, and the cost for getting started in a practice. My dad had a radiology clinic, and the overhead was the part he did not enjoy. And after 3 years, he burned out and just sold his part of the partnership. And he just wanted to get back to practicing and seeing patients and just focus on that. But that was over $100,000 investment he had to make when he started the practice. Not everyone can do that. And he was in his 40s when he did that. Now we see doctors working out at our facilities in their late 20s, early 30s. That's unheard of to see somebody being able to start their own practice like that.
Yeah, right out of residency.
It's amazing.
Yeah, and that was going to be kind of my other question is how how, because of the affordability, I mean, that's what it is, the
Mhm.
affordability and the accessibility that you're creating, as well as I think the kind of professional services shouldn't be overlooked, because that's really a big part of how you're supporting these practices into growing. How does that accessibility and that sort of that stewardship is the word I used? How does that play into your recruiting, specifically go in younger healthcare professionals? Are you going to schools of medicine or residency programs, things like that? Just curious.
Yeah, so we haven't really gone to the residency programs. That's something that we've thought about. We've been focusing on just having a really good website with SEO that can capture leads. But then
Nice.
the other thing that we've noticed is that um, you know the word of mouth is really powerful, right? Word of mouth marketing. And once one doc, gets in and they like the model, they like the service that we're providing them, they're going to tell their friends, they're going to tell their colleagues. And we've really grown quite a bit because of that. And we promote that. We actually give bonuses for that because the validation from another doctor is going to mean so much more than us just trying to pitch.
Yeah. Yep.
So, so yeah.
Yeah. As anecdotally, I've worked on the fundraising side of a business before myself, and I understand. And we worked with investment groups of doctors, and the doctors would rather listen to each other than listen to me come and talk to them. So I totally appreciate that. I did have a specific kind of like investment mechanics question related to what you're raising for right now. So when you make distributions to investors, what are those distributions? And the reason I'm asking is because Camaplan is a self-directed IRA administrator, and in self-directed IRAs you can have a unrelated business income tax liability. So I was just kind of curious if you could talk more about what what you're issuing at the end of the year to investors, and if you have any experience dealing with UBIT.
Yeah. So because we're not doing distributions, there is actually no UBIT that is going to hit investors. The everything from the business is getting reinvested to grow it. And like we were touching base on, the exit plan is really we're looking to get towards 100 million in value, and at that point to sell. And at that point, the investors will then get distributions of their shares value. When buying in, it's a safe. It's called a secured agreement for future equity. And then as
Okay.
these seed rounds progress, that converts into actual shares of
Okay.
value. Yeah.
Got it. Okay. So you do a safe. So investors buy a safe note.
Yep. Yeah, that's
Okay.
how it
Perfect.
works. One of the
All right.
things you mentioned with the dentist, I wanted to say, we actually have dentists on our wait list for our next location. So I think it's going to be at MedCoShare very soon. So we're
Yeah.
looking forward to having
All
those
right.
practices in there too.
Yeah, and I want to add to the reason why we don't do dividends or distributions. For us, and we come from a real estate background, so we're used to looking at deals with, like what's the cap rate? Is it a 10% return, 20% return? For us, we're trying to 10x the company. We're aggressive about growth, and at exit, we want an extremely healthy return for everyone. So it makes more sense to reinvest everything to get towards that, to go towards that, versus just giving, dividends every now and then, or just having maybe like a 10% return on your income. We feel like if that's what you're looking for, if investors are looking for that, there's a lot of other sort of companies that they can invest in. They can, put in the stock market. But we feel like if you have the appetite and believe in the idea, then this is a great, MedCoShare is a great way to invest it.
All right. Cool. That was my last question. I'm kind of lying. I have other questions, but I'm just going to be quiet. But we have no more questions in the chat, so I think we can go ahead and wrap it up. Let me put up your slide one more time here. Make sure I do it correctly. That's not the one that I wanted. Let's see. Yeah, there we go.
Matt.
Yeah, you bet. So yeah, any kind of final thoughts before we close out from you guys?
No, Matt, just thank you so much for doing this. And I would say if there's any local Philadelphia-based investors that want to come and do a tour, because we do have the physical locations, right? It's a product that they can see and touch. We would invite you to reach out to us, and we would love to give you a tour.
All right, beautiful. Well, yeah, thank you everyone for joining today, and thank you, gentlemen, for presenting today. We'll have this available as a recording, so you can come back and watch it if you'd like. If you have any questions about this investment, about the presentation that they weren't answered today, please reach out to these guys via email or the phone numbers on the address on the slide in front of you. So without further ado, we'll see you guys on the next one, and have a great rest of your week.
Thank you, Matt.
Thanks, everyone.
Take care, everyone.